بسم الله الرحمن الرحيم. قالوا سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. صدق الله العظيم. Good morning everybody. Errors of refraction by Dr. AHMAD GOMAA Assistant Professor of Ophthalmology, Al-Azhar University. At the end of lecture, you will be able to identify the refractive media of the eye and optical properties of each. Also, understand the purpose of measuring near visual acuity with and without correction and testing each eye individually. Finally, know optical principles of refraction of lenses. Refractive media of the eye and their optical properties. The light is the part of the electromagnetic spectrum to which the human eye is sensitive, which means the visible part of the electromagnetic spectrum. Its wavelength range is 400 to 760 nanometer. In space, light maintains a constant speed of about 186,000 miles per second, but as it travels through the substance of such a transparent body, it will encounter more resistance. This retards its progress. When a beam of light strikes a glass plate with the parallel sides, it's retarded while traversing the plate and then travels on unaffected. The visible light only can excite photoreceptors, while infrared rays can't excite but filter only as heat. And ultraviolet rays are filtered out by the crystalline lens. What's the meaning of refraction? It is the bending of light rays when they travel into transparent media with two different refractive indices, provided that they travel in an angulated interface. Refractive index of a medium equals velocity of light in air over velocity of light in that medium. For example, refractive index of a cornea equals 1.38, which means velocity of light in air over velocity of light in cornea equals 1.38. The refraction of light according to Snell's law. When rays strike from a less dense medium to denser medium, it will refract a rays close to the normal line. While when the rays strike from denser medium to less dense medium, it will refract it away from the normal line. But when the rays come perpendicular to the surface, it won't refract it. The ratio of the sine of the angle of incidence to the sine of the angle of refraction is constant and called index of refraction. The Snell's law of refraction. This picture shows first one, when rays strike from less dense medium to denser medium, it will refract the rays close to the normal line, which is the perpendicular line. While the second picture, when the rays strike from denser medium to less dense medium, it will refract it away from the normal line. The previous information will be applied to the eye, so refraction by the eye. To generate accurate vision by the eye, light must be correctly focused on the retina. This focus is done by refraction of the light. The eye is a compound optical system, consists of the cornea, or actually the ear-tear interface, is responsible for 2/3 of refractive power of the eye, because of the large difference in refractive indices of both media. The crystalline lens is responsible for 1/3 of the focusing power of the eye. The optical system of the eyes consists of anterior surface of the cornea, posterior surface of the cornea, anterior cortex, anterior core, posterior cortex, posterior core. The optical principle is the line from point I to point G passing through point V on the cornea, while the visual axis is the line between the point G and point H on the retina. The optics of the eye. Transparent media are responsible for refraction as they allow light to pass through to the retina. How we see. Light rays pass through cornea, pupil, aqueous humor, lens, and vitreous humor, then strike retina, stimulating rods and cones. Upside down image forms on the retina, and optic nerve transmit this image to the brain, so the brain turns upside down image into right side up image. The refractive media of the eye consists of 4 components: the cornea, the anterior chamber, crystalline lens, and vitreous. This table shows the refractive indices of the eye. The refractive index of air equals 1, and that of the cornea equals 1.38, and that for the aqueous humor equals 1.33, and that for the lens equals 1.4, and that of the vitreous equal 1.34. The cornea. The refractive power of the cornea is mainly due to its anterior curvature and significant difference in refractive indices of air and cornea. It is the transparent anterior 1/6 of outer layer. Its thickness is 1 mm at the periphery and 0.5 mm at center, which is richly supplied by sensory nerve index, branches of ophthalmic division of fifth cranial nerve. The cornea itself is avascular, but the corneoscleral junction is richly supplied by capillaries. It derives its nutrition from aqueous humor in the form of glucose, tear film in the form of oxygen, and corneoscleral capillaries. Its vertical diameter is slightly less than horizontal one. The front optical radius equals 7.7 mm, while the back optical radius equals 6.8 mm. Actual refractive index of the cornea equals 1.376. The power of the cornea equals about 40 diopter. Not optically homogeneous because there is a difference in refractive indices of the ground substance and the collagen fibers of the cornea. What is the function of the cornea? It is the most powerful refractive medium of the eye. It represents 2/3 of refractive power of the eye and participate in the formation of sharp, clear image. Also, play an important role in protective mechanism for the sensitive intraocular structures because its stuff absorbs ultraviolet rays and the initiator of corneal reflex, which is a protective reflex. The cause of corneal transparency. There is an anatomical causes and physiological causes. Anatomical structure of the cornea, non-vascular, regular arrangement of collagen fibers of substantia propria. Also, the nerve endings has no myelin sheath. The physiological cause is the corneal dehydration, which is achieved by an active endothelial pump and maintenance of corneal fibers back together. Ocular chambers and fluid. The lens divides the ocular cavity into 2 chambers filled with intraocular fluids. Posterior to lens filled with vitreous humor and is called the vitreal cavity. Anterior to lens divided by the iris into anterior and posterior chambers. The anterior chamber is the space between cornea and iris filled with aqueous humor. Its depth is about 2.5 to 4 mm. A change in EC depth will lead to change in the total power, so 1 mm forward shift of lens will increase about 1.4 diopter in power. Refractive index of aqueous humor equals 1.336. The aqueous humor is a clear, transparent fluid filling anterior and posterior chambers, formed by the epithelial lining of ciliary processes of ciliary body at a rate of 1 to 3 microliter per minute. It's composed of, when compared to plasma, it's alkaline, nearly protein-free fluid, higher sodium and bicarb content, higher vitamin C and pyruvic acid and lactic acid, and lower glucose level. Functions of aqueous humor. It is the one of the refractive media of the eye, supply oxygen and nutrition for the vascular cornea and the lens, also buffering and removal of acid products of anaerobic metabolism of cornea and the lens, and keeping intraocular pressure constant by the balance between its formation and the drainage. Iris and the pupil play an important role in the focusing mechanism of the eye. They regulate the amount of light entering the eye, and at 2.4 mm pupil size, the best retinal image is obtained, as absorption, as aberration and diffraction are balanced. When the pupil gets small, the depth of focus increase, and this is the principle of the pinhole test in refraction. With large pupil, the size of blue circle increases. Vitreous humor. Transparent gelatinous mass held together by fibrillar network, filling the space between lens and retina, separated from lens by a very narrow retrolental space, enclosed in a thin hyaloid membrane which is firmly adherent to retina around optic disc. Its function, one of the refractive media of the eye, also support of intraocular structure and the maintenance of spherical shape of the eye. The crystalline lens. It accounts for about 1/3 of the refraction of the eye. Accommodation provides a mechanism of focusing at different distances. A biconvex lens composed of a strong elastic capsule filled with viscous transparent proteinaceous fluid. The lens diameter equals about 10 mm and its thickness is about 4 mm. The capsule is attached to ciliary body by suspensory ligament. The tension of these ligaments is controlled by ciliary muscles. What are the causes of lens transparency? A uniform arrangement of fibers, no blood vessels and hydration, normal lens metabolism, and also the lens is avascular. What the changes occurs in cataractous lens? Visual acuity reduced, myopic shift, monocular diplopia, also there is a glare and color shift. This table shows the most important information about crystalline lens. Its thickness ranges from 3.5 to 4 mm at birth, then increase at adult life, ranges from 4.75 to 5 mm. The radius of curvature, the anterior surface equals 10 mm, posterior surface equals 6 mm. The refractive index of the lens, the nucleus 1.41, while the pole 1.385 and the equator 1.375. The total power ranges from 15 to 18 diopters, while the accommodation power at birth equals 14 to 16 diopters, and at 25 years it ranges from 7 to 8 diopters, and at 50 years old it ranges from 1 to 2 diopters. What is the function of the lens? It is the second major refractive medium of the eye. It represents 1/3 of the total refractive power. Also, it preventing damaging ultraviolet radiation from reaching the retina. And it is the only player responsible for adjustment for distance. It can increase its refractive power in response to nerve signals from the brain, providing the important mechanism of accommodation. Visual acuity. How do we measure vision? It's done by Snellen eye chart. We assess the vision. The chart is at about 6-meter distance from the person. May be closer if the visual acuity is less than 6 meters. May be counting finger assessment, hand movements, perception of light, and no perception of light. Snellen letter subtends 1/5 of overall height. Snellen notation is visual acuity equals d1 over d, while d1 is the standard viewing distance, which is 6 meters. It is the distance between the person and the chart. D is the distance at which each letter of this line subtends 5 minutes of arc. For example, when a person has a visual acuity equals 6 over 12, it means he can see an object from 6 meters, while the normal person can see the same object from 12 meters. Near visual acuity. It's indicated when patient complains about near vision and distance testing is difficult. Distance specified on each card equals 35 centimeters. Refraction by the cornea and lens. Image focused on retina is inverted and reversed from left to right, but the brain learns to work with that information. 75% of refraction is done by cornea and the rest is done by the lens. Emmetropia is the refractive status of the eye where the image of an object is focused on the retina. So it's equal measure. So the visual acuity is 6 over 6, no refractive error, and it is a desirable optical system. Accommodation reflex. It is the ability of the eye to keep the image of an object focused on the retina as the distance between the object and the retina varies. It is the change occurring in the eye as a result of retinal blurred image of the near object. What is the components of this response? It's composed of 3 items referred as the 3 C letters. Constriction of the pupil, increase the convexity of the lens, convergence of the eyes. The lens is able to change its shape. The stimulus is the blurred image. The lens tries to bring the image into focus just like a camera. For near tasks like reading, the lens thickens, increasing the power. This is called accommodation. The lens becomes more spherical during near vision by contraction of ciliary muscles. The amplitude of accommodation is the difference between refractive power of lens on maximum accommodation and in far vision when the lens is fully relaxed. It decreases gradually with age due to a loss of lens elasticity and weakness of ciliary muscles. Near point, it is the minimal distance from the eye at which an object can be brought into focus. It recedes with age. This table shows the nearest point and the amplitude of accommodation in relation to the age. At the 10 years old, the nearest point equals 10 centimeters and the amplitude of accommodation equals 14 diopters. While at 60 years old, the nearest point equals 100 centimeters and the amplitude of accommodation equals 1 diopter. What is the common refractive errors? The common refractive errors are astigmatism, hyperopia, and myopia. Astigmatism is the refractive status of the eye in which the light rays don't focus sharply on retina. While hyperopia, it is the refractive status of the eye in which the image of an object is come to a focus behind the retina, and also called farsightedness. While myopia is the refractive status of the eye in which the image of an object is come to a focus in front of the retina and also called nearsightedness. This picture shows a hyperopic eye in which the focal point comes to a focus behind the retina. So we can correct hyperopia by placing a convex lens in front of the eye, so the parallel rays get more convergent and then come to a focus on the retina. This picture shows a myopic eye in which the image of an object comes to a focus in front of the retina and also can be corrected by placing a concave lens in front of the eye, so the parallel rays get more divergent and then focused by the optical system of the eye to come to a focus on the retina. Presbyopia, it is the physiological progressive loss of accommodation with age due to loss of elasticity of the lens, until the lens becomes totally non-accommodating at the age of 70 years. It can be corrected by wearing convex lens for near vision. How to assess the near vision? The near vision charts for testing near visions are Snellen near vision chart, Jigger chart, Roman test type. So, ask the patient to sit with his back to the light. If the patient is using glass for distance, the same number will be put on the trial frame. Occlude one eye with an occlude. Ask the patient to hold the near vision by his right hand at a distance of about 33 centimeters. The patient is asked to read the chart from bigger print size to smaller print. The line which he reads up to is recorded, and repeat the test for the other eye. How to correct the refractive error? The refractive errors can be corrected by glasses in the form of convex lenses or concave lenses or cylindrical lenses. Also can be corrected by the use of contact lenses and can be treated by a refractive surgery. Optical principles of refraction of lenses. The lens is a transparent material which is limited by spherical surfaces or spherical and plane surfaces. The kinds of lens may be a convergence lens or divergent lens. Refraction by lenses. The lens is composed of two smooth curved surfaces that are aligned and enclose a uniform optical medium. The first surface of such a system tends to focus parallel incident rays, and then again at the second surface a further focusing occurs. There are many types of spherical and cylindrical lenses. According to the shape, it's a biconvex, planoconvex, convex meniscus, biconcave, planoconcave, concave meniscus, concave cylinder, and convex cylinder. Principal rays for converging lenses. When a light rays pass through a convex lens, it takes one form of three forms. Rays parallel to the optical principal axis pass through the principal focus after refraction through the lens with the blue line. Rays coming from the principal focus emerge parallel to the principal axis after refraction through the lens, the red line, while rays passing through the optical center are not deviated, the green line. In the same way, in concave lenses, the rays take a form of one of the three forms. Rays parallel to the principal axis are refracted, and the extension of the refracted rays pass through the focus, is the blue line. Also, if rays are incident on the lens in such a way that their extension pass through the focus, they are refracted parallel to the principal axis, the red line. But rays passing through the optical center are not deviated, is the green line. Parallel rays coming from distance over 6 meters will be bent towards edges of a convex lens. At certain curvature of the lens, these rays will pass through a single point, which is called focal point. The focal length is the distance between central part of lens and focal point. Dioptric power of lens is a measure of its ability to refract light rays. Refractive power equals 1 meter over focal length in the form of diopters. Thus, dioptric power is inversely related to focal length. This picture shows two lenses of different size. The lower one increases in thickness, so its power is more, and the focal length is shorter, so the parallel rays come to a focus near the lens. And so far, convex lens converge light. The thicker the lens, the greater the convergence. Thicker lenses equals more power, equals more convergence. Amount of convergence depends on type of incident rays. This picture shows two concave lenses of different sizes and thicknesses. When the thickness is increased, the power is greater and the divergent power is increased and the focal length is decreased. Concave lens diverge light. The thicker the lens, the greater the divergence. Thicker lenses equals more power, equals more divergence, and amount of divergence depends on the type of incident rays. Thank you.